Healthy Choices, helping you live healthier. Sponsored by Intermountain Health.
Welcome back, everyone. A new Intermountain Health program allows pharmacists to prescribe hormonal birth control to adult women in Utah through telehealth visits. In the sponsored segment, we have Chief Pharmacy Officer Carrie Dunford and OBGYN Dr. Matthew Wells to talk about the impact of these changes. And first, if you could explain the Utah law that changed.
Yes, in 2021, the legislature agreed to allow pharmacists to prescribe some medications. And they've worked with the Department of Health and the Board of Pharmacy to determine a few categories that we're going to start this out with. They are hormonal contraceptive, smoking cessation, naloxone, and HIV PEP and PrEP.
And so we're starting out, rolling out first with Intermountain Health and doing birth control, right? And then we're rolling out the others later on.
Correct.
Tell us how the impact is and how this program works.
This really allows women to have some control and timeliness for birth control prescriptions. Many women have to make appointments with providers, and it can take a lot of time to arrange that. And so this allows for some customer-centric time where you can pick the time when you fill out this form. A pharmacist will call you, and then the prescription is filled and mailed to your house.
And this is all through telehealth?
Correct.
A $20 fee, and a lot of times your insurance covers that.
Yes, we have two payers. Select Health and Medicaid will pay for this service. But patients can still pay for it themselves and not have to, then they can run their prescription through their insurance.
Okay, so doctor, how does this help the whole entire system? Because that's a ripple effect. Maybe giving you some time to see other patients, perhaps.
No, definitely, Saray. It really is. It helps us to be able to see the higher acuity patients. Maybe someone needs surgery that would be put off because patients are needing to get in to see us to get birth control. And so this really increases access to care on the patient's time, right? You can do this at midnight, and the next day we'll contact you instead of having to put aside the necessities of life that we usually come in conflict with during the middle of our day.
And doctor, how many times have you heard the story of, oh, we can't prescribe that unless you come into the office, and it's a quick little 5-minute maybe conversation when you could be freed up to see some of those acute patients?
You know, this is really the old way of thinking, that patients need to be in the office. And the silver lining of the pandemic is that we saw that it's safe to be able to prescribe medications like birth control over telehealth visit.
And I was just telling you, I ran into a problem with a gap in my medication because of maybe what they were setting up. And the program really helps in making sure that there is no gap in medication.
Certainly, we recognize that prescriptions in Utah are only good for a year from when they're written, and so you can only refill it for 1 year. And it's probably not first thing on your mind to look every day to see if your prescription is going to expire. So this is an option that is a quick turnaround so that people can continue their therapy, because we all know with birth control, if you don't take it every day, it's not effective.
It's not effective. Are there any limitations or restrictions?
It's adult women over 18 is a restriction, and then there are certain health conditions that may make you too high of a risk for a pharmacist, and we feel like a physician should assess those patients. But the good thing about this program with Intermountain is that we have great connections to physicians like Dr. Wells, and we'll transition your care to a physician and help make sure you get quick care.
And so telehealth and getting the prescription that's needed for birth control doesn't take the place of your regular checkups, your OBGYN yearly exam, and other concerns you might have, right, doctor?
No, exactly right. And we really want people to have a choice about their birth control. And our first recommendation is a long-acting reversible contraceptive like an IUD or an Nexplanon. But people get the choice in how they take care of this. And so we want to offer those options for them. If they want a long-acting reversible contraception, they can still go through this platform, and we will help them get into one of us to have that place.
Each of you, what is your hope and the impact you have, your hope for women?
My hope is just that this is more convenient for them. I understand how difficult it is to balance a life and kids and everything. I hope this is the most convenient option.
You know, I'm a male, so I'm going to defer to Carrie and see what she wants. And that's what's most important, is that the patient gets what they want.
All right. Good, great message. And if people want to find out more information and they want to jump on that telehealth program, where can they go?
intermountainhealthcare.org/birth control.
And that phone number there, it's that pharmacy birth control program through telehealth. It's 801-284-2500. For more information, you can always log on to intermountainhealth.org. Thank you to the both of you.
Thanks, Siri.
And thank you to Intermountain Health for sponsoring this interview.